everyone. Welcome to Monday up here at the Capitol. And obviously, my name is Delegate Doug Skaff, the Minority Leader for the House of Delegates, and I'm excited to be back here with you today with my colleague from the Senate. I have Senator Stephen Baldwin, the Minority Leader on the Senate side, Dr. Ron Stollings, Senator from Boone, Senator Richard Lindsay, Delegate Dave Pethel. Normally at this time at 10 o'clock on Mondays, we come to you with a topic and a focus of interest of what we do as a legislature on the Democratic side, an issue that we're focusing on. This week, we're going to put that on hold and move that to hopefully next week, because we had a serious issue that happened over the weekend. As you all know, there was a COVID positive outbreak here on the House of Delegates side. And first and foremost, our heart and our prayers go out from our colleague, Delegate Brandon Steele from R-Raleigh County, who was tested positive over the weekend, who was the Gov Work Chair. And we don't wish that on anybody's family. The magnitude that, COVID is still out there. COVID is real. This pandemic is still going on, and it affects each and every one of us. And we can't let our guards down. Whether you're up here in the Capitol, whether you're out in your normal everyday life or in the public, the magnitude of this thing is serious and real. Now, we're doing a great job as a state, and most people are getting their vaccine, and we're moving forward, but this thing is not over. It's far from over. And this is a real life example of how it's going to affect us and how we navigate and how we move forward as the legislative body. On behalf of the House of Delegates side, speaking with Speaker Roger Hanshaw last night, I know we are going to have there'll be a mobile lab set up outside for people to get tested. But this is a very serious issue. We are calling on and asking the Speaker as this morning to abide, stand up, and stand by the rules that we adopted on day one of this session, which was mandatory mask order. People are still not following the mask order. Elected officials are not taking it seriously. On the House floor, walking in the hallways, we have staffers. We have our legal team who have yet to be vaccinated. This is a serious issue. You can't take it for granted. This COVID does not identify with anybody. It knows no barriers. It's not going to stop any person up here walking the hallways. It could be everywhere. We have to take this seriously. So we're asking and calling on the Speaker and the House of Delegates. We adopted rules on day one to require everyone sitting in the House chamber to wear a mask. If not, you got to be up in the galleries. And we have yet to abide by those rules. Number two, walking in the hallways, coming into the building. We're calling on the Capitol Police and asking them to help us navigate this, help us monitor this. We need to enforce that and take this very seriously. With that, I want to turn it over to my colleague, Dr. Ron Stollings. But the bottom line here is this: we are all in this together. Democrats, Republicans, it doesn't matter. We need to be respectful of each other, respectful of walking down the hallways. When you're walking into the building, when you're walking out of the building, think about the families that you affected. Now, Delegate Brandon Steele, he has kids back home, and I pray for them and hope that they don't get this. But the bottom line is there's a lot of people in this Capitol that yet to be vaccinated, and we need to take this thing seriously. And when one of our members is affected, it affects all of us. And who knows what the outcome is going to be. We hope that nobody else gets COVID, but if so, we'll need to take those measures, and look at this case seriously, day by day basis, and pray that nobody else gets it. Dr. Stollings?
Thanks, Doug, and just echo all that he said. I mean, we're leaders in this great state of West Virginia. We should be being an example as to what we should be doing. We should be following the CDC guidelines. I'm very glad to hear last night when we talked to the people from the Bureau of Public Health that there is going to be contact tracing, a lot of testing, again, following the CDC guidelines. We also have protocols here in the legislature, and we still have 2 or 3 senators that just refuse to wear a mask. And, the anti-mask, the anti-vax mentality is alive and well here in West Virginia. And that saddens me. 2,606 West Virginians have died due to COVID. Some of those were my patients. Some of those were my best friends. This is serious. The other thing that we are seeing now more and more are these variants that we hope, and so far are still covered by the vaccinations. But still yet, those variants can pose a real issue as we go forward. So far, 267,927 West Virginians have had both vaccines. That's about 15%. Now, the good thing is we're moving on pretty quickly. Another 441,903 have had their first vaccine. So we're moving in the right direction. But it's not over. 15% of West Virginians have been fully vaccinated. Now think about that. 2 weeks after you've had your second vaccine, you're considered to be relatively immune. But can you still spread it? The folks at the CDC says, yes, you could. So we still need to wear our mask. We need to follow our CDC guidelines, and we need to care about each other. We're West Virginians, folks. We don't want to lose another West Virginia. We don't want a third spike. Everybody's got COVID fatigue. Everyone does. You just got to hang in there. And our good friend, said, for a sports analogy, you go in, you score a touchdown. You know what? We see light at the end of the tunnel. Let's not spike the ball on the 15 or 10-yard line, okay? Let's get it in the end zone. Thank you.
Good morning. I'm Stephen Baldwin. I'm the Senate Minority Leader, and we're going to take your questions in just a few minutes here. I'm sure there are several questions. There's some folks here in the room. I know there are folks participating virtually who have questions. Just want to say a couple things before we get to that point. A little bit about what happened yesterday. Got a new mask on here today that's not cooperating. Yesterday, I was doing Sunday school in the morning, started getting texts and calls from folks about the situation that was going on here at the Capitol. And I echo Minority Leader Skaff's comments. We certainly, at the top of our list, we're praying for Delegate Steele and his family and praying that all is well with them and their health. We spent the day then trying to figure out exactly what the situation was. Working with the HHR, the Bureau for Public Health, our clerk in the Senate, President Blair, and I want to thank those folks. We have the Bureau for Public Health, DHHR, they have been protecting all of us across the state for the past year, and those efforts sometimes go unnoticed. I want them to know they do not go unnoticed to us. We greatly appreciate all the hard work that they put in to try and protect the state. I want to thank Speaker Henshaw and President Blair. I think they have they stepped up to the plate. They are concerned about the situation here. But as Minority Leader Skaff and Senator Stollings said, there comes a time when things need to get real. And we are at the time when things need to get real. Masks need to be worn at all times. They need to be worn when we're voting. They need to be worn in the hallways. They need to be worn in committees. They need to be worn in offices. That's the way we are going to move past this situation we're in now. We've got to have testing. Got to have regular testing. And we're going to pledge to go ahead and be tested this week, even if we were not direct contacts, just to make sure that this event doesn't spread any further. We've got to have reporting. Now, this is what's concerning to me, and we actually have a rule about this in the Senate. If you have a close contact or you have any reason to suspect that you had close contact or have symptoms, you are to report that. You're to report that to the presiding officer so that if there's a situation, we can get to the bottom of it immediately and not have that spread any further. That's got to happen in this case so that this one case doesn't turn into multiple cases. I apologize, this new mask is giving me problems here this morning, but in some ways this new mask says it all. Love thy neighbor. That's what it's all about here. Instead of acting selfishly, we need to act with one another in mind. We've got to treat each other like we want to be treated. And I know we all want what's best for West Virginia. And that means that we all, as individuals, need to look out for our neighbors. And if that means doing something inconvenient, like wearing a mask, then we need to do it. We need to do it here in the Capitol. We need to do it all across the state. because this isn't just about one incident that occurred here at the legislature last week and over the weekend. This is about us as a state. It's time to be responsible. It's time to be adults. It's time to be the bigger people and move West Virginia ahead, as Doc Stollings and Leader Skaff have talked about. So with that, I'm sure folks have questions. We have folks on the chat who may have some, and we have folks here in person. So we'll open it up to questions at this time.
Probably Delegate Skaff, but I guess no, both sides of the chamber. Do you have any numbers on how many people working in the Capitol complex aren't vaccinated yet? I know the legislature is, but in terms of staff and lawyers and state employees, is that?
Well, I know in the House of Delegates, from a member standpoint, only 86 out of 100 got vaccinated. So there were still about 14 people that chose not to be vaccinated. And, you know, that's a personal right that they have, but still it's what Senator Baldwin said. It's about being respectful to the others and the people you work with. I know in the GovOrg situation, 2 of his lawyers on that committee were not vaccinated, who were in close proximity to Delegate Steele all week, working closely. They are to quarantine for the next 10 to 14 days as well. And I encourage everybody who's in close contact that definitely weren't vaccinated to stay quarantined. But I don't have a specific number underneath the Capitol. Pete, you guys?
On the Senate side, I believe it's 25 or 26 out of 34 senators have been fully vaccinated.
The per diem staff are the ones that hadn't really had all their vaccines yet. Okay, I have a more senior assistant, incredibly talented, but she just got her second vaccine the end of last week. And I think that there are several like that. So she would still have another 2 weeks before she would be considered protected.
From my understanding, delegates are allowed to take off their mask whenever they address during session. Do you agree with that? Do you think that that's problematic moving forward?
I think it's problematic moving forward. Now that we know what we know today, I didn't really agree with it. I spoke 3 times on the floor, and 2.5 times I wore my mask, but my mask fell off the 3rd time. But I think it's important to keep your mask on, pull the microphone up. You know, Delegate Steele stood up on Friday and spoke very lengthy without his mask on. And I just pray and care about all the people that were around him. There were staff around him. There were per diem employees around him. There were other delegates around him. Not quite sure if they're following the quarantine process yet or not. We'll know later today, but I think they should wear a mask definitely anywhere inside the Capitol. Treat us no differently than the rest of West Virginia and every other small business you go into or restaurants. It's about respect for your others. I think we should wear a mask while we speak, yes.
How do you guys go about prompting that change amongst other lawmakers? It seems like a personal responsibility. Are you guys going to be doing anything with the upper level trying to change those rules? Maybe saying, hey, now that this is happening, maybe we should be wearing our masks.
Yeah, if I can speak to that. There was a letter that went out from Speaker Hanshaw and President Blair last week about this very topic. And it was very clear. If you're a legislator and you are not wearing a mask, then you are subject to the Sergeant of Arms removing you from the building for doing so, for not wearing your mask. So what we're saying is it's time to enforce that, plain and simple.
Paul Mullen from WCBC asks, should the session be suspended until contact tracing is completed and analyzed? And do you believe that legislative meetings should not be convened until all are wearing masks?
Well, certainly all should be wearing masks. With regard to the shutting down of the legislature, I think that they are trying to assess the situation now. I know that there was a dinner gathering of some folks that, including my understanding, Delegate Steele, is that right? And so you worry about those super spreader events. I guess in a perfect world, yeah, I mean, to be out of the abundance of caution, you could hold the legislature at least until we got the testing back. The problem is, based on the incubation time, the testing may be 4 and 5 days later before someone would become positive and still, have the COVID. So again, the folks at the DHHR are trying their best, in my mind, to do the best possible things with regard to, and they are following the CDC guidelines. I've been vaccinated. I've had both my vaccines a month ago. So it's not me that I'm worrying about so much, but it is about people that have not been vaccinated and fully vaccinated. That is the real issue here. So I'm not sure about shutting it down. I think it depends on our testing and on contact tracing, because that's going to be very important, because there's been a couple potential super spreader events. And so folks that don't like to wear their masks, folks that don't like to get their vaccines, I think science might be about to catch up with you.
And I spoke with Delegate Steele on when I first found out about this, and I pleaded and begged him to ask and make sure you go through all the details. You write down everybody that you've come in contact with over these last few days. Please take this very seriously. It's the least you can do for everyone up here. I think I applaud Roger Hanshaw, Speaker Hanshaw, and I. We spoke last night at great length about it. Believe me, he is taking this seriously. He's doing everything he can. I called on him last night to let's follow the rules that we set in place. Let's start reprimanding people who are blatantly disrespecting the laws or the rules that we set forth. He did say, I think it's we're handling this one as an individual situation, this one issue. If you see others, I think it's a no-brainer that we need to delay session. If you see a second and third case start popping up here at the Capitol, we should stop immediately and quarantine everybody, go away for at least 2 weeks, and come back when it's safe.
If I could just chime in as well to Paul's question. I asked that question of the state epidemiologist last night. And my understanding of her response was that it's really too soon to know. She thought that at this point, there was not a need to stop the session. She didn't think the risk was that great, but that it would depend on a couple of things. The test results that we begin to get back, which can't happen until tomorrow because of the incubation period, but also if we're dealing with a strain or not. If we're dealing with one of the mutant strains of COVID, then that's a different situation. She said that typically takes a week to find out if you are, so we won't know that for a week. So I think it remains to be seen at this point, which is why right now it's so important to do testing, to wear masks, and to report if you have any symptoms whatsoever.
David Beard asks, some legislators are wearing the mesh masks. Are they considered effective? And if not, should they be banned in the Capitol?
Goes back to taking this thing seriously. The mesh masks are a joke. It's disrespectful. It's not taking the situation seriously. What more do we need? We've had a case right here, just down the hallway with one of our own members. You don't start wearing the proper mask, then they should be removed from the chamber, sit up in the gallery, or asked to leave the building. Hope that answers your question.
They are not effective, and they are a mockery of science.
And I applaud West Virginians. Most people are doing it right. You just have a handful of bad actors and people that are trying to make a joke out of this and not take it seriously. And unfortunately, these are the ones that causing us to stand here today and talk to you about the situation. And we've made it quite some time, 3/4 of the way through session, but most people doing it right. It just takes one.
Are there any other lawmakers you'd like to call out in particular for not following the rules?
They know who they are. I mean, anyone who's not wearing their mask properly, anyone who's wearing a fake mask, anyone who's walking down the hallways, not being respectful of others. I mean, come on. We asked the staff, we asked the per diem, we asked people who are out there going to the small businesses and to the restaurants. You see people posting signs that say, our business is glad to be open again, but just be respectful of others. And that's all we're asking our fellow colleagues as leaders of this state. The least they can do is wear their mask properly or wear a real mask. Thank you all. Appreciate it. And this is a fluent issue, so I'm sure, we'll wait to get the testing back and hopefully all goes well. But if not, I'm sure we'll be talking again. Thank you all.
Thank you.